Hi everyone, and welcome to the first TUC webinar of 2026. This is going to be a fantastic session. We've got hundreds of people registered, so I'm going to give it a minute or so to let the Zoom space fill up so no one misses anything. While we're waiting for that, please do say hi in the chat. Tell us your union, where you are in the country. We always love to hear from you. Hi, everyone that's just joined. You're all very welcome. We've got already 500 people here in the Zoom room with us. We're just waiting for a few more to join us. We'll be getting going shortly. And hundreds of people already saying hello in the chat, which is great to see. Okay, everyone, I am going to start with a bit of housekeeping because we've got a lot to get through today. So very warm welcome to the first webinar of 2026. Happy New Year to you all. We hope this will be the first of many great webinars this year. We're going to be talking about stress, specifically workplace stress. And I think it's very telling that we've got so many people registered and so many people joining us. And we'll be talking a bit more about that and about what a serious workplace concern that is shortly. A little bit of housekeeping first. We have got live captions, so if you would like to follow along with those, please click the captions button, which is underneath the video screen. Then you can follow along with those. We are, of course, recording today, as we always do. So if you miss anything or you need to leave early, don't worry, we'll send you a link to the recording, and any links and resources that we talk about today, we will make sure they are sent out to you as well. If you've got any questions for our panel, please post them in the Q&A section. Again, below the video screen, it's in a speech bubble that has a question mark in it. Please post any questions there, and we'll try to get to as many of them as possible during the session. Before I hand over to our panel, I'm just going to talk a little bit about this publication, which is Hazards at Work. This is a really important resource for health and safety reps. It has a whole chapter on the subject we're going to be talking about today, which is stress. So do please order a copy if you've not got one, or recommend it to your fellow reps, your friends. We've just posted the link to the order form there if you want to order. So I'm joined today by four speakers. First, we're going to hear from Shelley Asquith, who is the TUC's Health and Safety Officer. Then we're going to hear from Jamie McGovern, who is from the CWU. And then we're going to hear from Dave and Shirley, who are UCU reps at the University of Birmingham. But I'm going to let Shelley get going now to set the scene. Over to you.
Hi, Anna, and hi, everyone. It's great to see in the chat that people are calling in from all over the country. So I'm just going to give you a little bit of background context as to what the issue is. So last week, we, the TUC, published our biannual health and safety rep survey. And in it, we ask safety reps about their experiences, what the major risks and hazards are in their different workplaces. We have thousands of health and safety reps tell us what the kind of risks and hazards are that they and their members are dealing with. Now, we've been running this survey for 15 years now, and every single time we've run it, you or your health and safety reps have told us that the most common health and safety issue faced by members is stress. However, this time around, we had a record number of reps cite stress. A massive 79% of safety reps told us that work-related stress was one of the most common and concerning hazards in the workplace. So we know that a huge majority of health and safety reps are supporting members with work-related stress. A huge majority of unionised workplaces are causing workers to become stressed. And what came below stress in our survey are risks that I would consider stress triggers. So, for example, workload also came very high as a risk. Bullying and harassment also came very high. Violence and abuse also came very high. Those are all health and safety risks in their own right. However, they also contribute to work-related stress because if your workload is so overwhelming that you cannot manage it, that is eating into your personal life. It is causing you to work longer hours. It's causing you to feel like you don't have control over your own work. You're going to become stressed. If going to work leaves you anxious of being on the receiving end of a bullying manager or a colleague, or harassment or physical verbal abuse from a customer, a patient, a passenger, whoever it may be, that is going to cause you stress. So all these things mixed together are making stress the number one concern. The Health and Safety Executive also recently published its annual statistics. Now, these stats tell us about the official records relating to work-related ill health, the reasons why people are taking time off sick. And similarly to our own data, the HSE's annual statistics also pointed to record levels of work-related stress. The number of workers reporting it and taking time off work rose from 776,000 in 2023 to 964,000 in the last year, an unprecedented increase, and nearly 1 million workers. With all of that in mind, you might expect employers to be taking this issue seriously. But of course, we know that's not the case. And when we asked health and safety reps how many of their employers are conducting a risk assessment for work-related stress, whether that's including stress in their overall workplace risk assessments or doing a specific stress risk assessment, can you guess what proportion of safety reps said their employer had done this? If you're thinking it's a minority, you would be correct. Two-thirds of reps told us they are not aware that their employer has carried out a stress risk assessment, either because they know they haven't done one or because they've got no idea that one exists. And if a safety rep doesn't know about a risk assessment, chances are it probably doesn't exist. So while almost 80% of unionized workplaces have a work-related stress problem, I would say even crisis, only 30% of those unionised workplaces have a stress risk assessment to work out why that's happening and what an employer is going to do to try and prevent it. As many of you will know, lots of employers say they are dealing with stress by doing anything but preventing it. They might be running well-being workshops, providing free yoga sessions. They might be training up mental health first aiders to deal with people when they're at the point of crisis, or providing an EAP with counselling services. None of those things are bad in and of themselves, but they are not preventing the causes of work-related stress, and they are identifying individuals with a stress problem rather than looking at this as a collective threat to all of our health and safety. So this is, of course, a major problem, but it also presents us with a huge organising opportunity. Health and safety reps in particular have got the knowledge, they've got the training, and you've got the rights to do something about it. Now, that's me setting out the landscape of the problem. I'll speak to you again at the later on in this webinar about the resources that the TUC has got that we published last week that are designed to help you take action. But for now, I'm looking forward to hearing from Jamie, Dave, and Shirley about their actions and their advice on taking this to your own workplaces and getting organised.
Thanks, Shelley, for setting the scene there and giving us a great introduction to this subject. As Shelley said, she'll be coming back later to talk about the tools that we've got to help you as reps carry out stress risk assessments. But first off, Jamie's going to talk about some real practical examples that he has used in the workplaces where he represents members. But first of all, we've got a question for him to introduce this to someone who might not be familiar. So, Jamie, what do we mean by a stress risk assessment? What exactly are the details of that, please?
Stress risk assessment sounds complicated, doesn't it? And it really isn't. It's an evaluation of risk. That's all it is. And this starts through a conversation. It can be an individualized stress risk assessment where it's one-to-one, where it's an individual stress risk assessment. The HSE's Talk and Toolkit is a really good example of that. Or a stress risk assessment can be one that looks at a whole workplace or a whole function or a whole shift. So we've done both. We've done the individualized stress risk assessments and we've done the whole workplace stress risk assessments. But I want to try and debunk the myth. As soon as people hear the word stress risk assessment, they think, oh, I can't even begin to imagine how I'm going to tackle this. But try and understand that these are not complicated processes. The best and most easy way of understanding the stress risk assessment is developing a listening ear. Once you develop a listening ear and you listen to the risks that are being presented to you and create a stress action plan, it's very, very straightforward.
Thanks, Jamie. That's put it in a bit of context for us about what we know what a risk assessment is, but now we know as well what a stress risk assessment is. So you talked a little bit about the HSE stress tool. I understand that you've made a couple of tweaks to it, enhancements to help you when you're conducting a stress risk assessment. Can you tell us a bit about that, please?
Yeah, so we've talk about the whole workplace stress risk assessment or the stress evaluation tool that we've used quite a lot. Obviously, the stress indicator tool is available. I think you put the link in the chat there for people to use. I see the stress indicator tool, even though it's a HSE tool, but I see it as a trade union resource that trade unions can use. When I first saw this, I thought this was fantastic. I don't eulogize about the HSE a lot, but I think this is one of the best things the HSE have done in many, many years. I've been a safety rep a long time. What the stress indicator tool does, it concentrates on the six key stresses that exist. So work demands, work control, work support, work relationships, work role and work change, and it formulates its questions around those six key stresses. So what you do is what we've done is we've presented the HSE stress indicator tool. It's like 35 questions to our many workplaces out there that have used it. And then all we do is harvest the information. And you can present this as trade unions in different ways because the HSE actually encourages this, potentially using the likes of Google surveys or Microsoft Form surveys. Use the HSE's questioning tool, present it to your workforce, and then harvest the information and put it into the stress indicator tool. Because once you put the information into the stress indicator tool, it actually self-quantifies the risk. It's a fantastic tool. It does all the work for you. All we've done from a CW perspective is add extra tabs onto that tool and drill down further with our analysis. So we've really, done some more to it, but the basics are there when you use the stress indicator tool, and it will give you a summary of the stresses that I've mentioned, the six key stresses. It'll also give you a summary of the question by question answers, and it gives you key areas to concentrate on. So as a trades union, if you're then going to try and present this information to the employer, you've already got the starting point of a stress action plan because you know where the key stresses are, because basically the people are telling you in these survey responses. So I think a bit of key advice, maybe think about copying and pasting the HSE's questionnaire that exists and use it to create wide stress surveys within trade unions because it's really worked well for us and it's not that difficult. And again, just to emphasize that point, recently some of our colleagues in one of our national Utah branches, they've undertook this for the first time, and I don't think they'll mind me saying they went from a starting position of not knowing what this was to really having a really good understanding of what it is, how to use it, and the work they've done on this in evaluating the stresses of their colleagues has been fantastic. So it shows it can be done from a starting position where people don't fully understand it, but it's a great tool. I'd urge people to use it if they can.
Thanks, Jamie. And we've posted the link to the tool in the chat. Don't worry about if you miss it now, we'll make sure that gets sent out to you all as well. So, Jamie, have you got any examples you can share with us of where you've used this tool in a workplace that you're involved with, and what maybe happened after you gathered this information and this data?
Yeah, so we've used this on many occasions actually. I mean, sometimes the employers will be less keen on receiving this information because very often, when trade unions do this, you'll get a real version of the truth. You really will. You'll get honest answers. And what we've done with our enhancements to it is give people the opportunity to comment on what they think will make stress better for them in the workplaces. So as well as the 35 questions, we have comment boxes in there as well. I mean, unfortunately, we found on some occasions where the employer doesn't want to talk, but sometimes we have to force them to talk. Like I'm sure our colleagues from Birmingham University will enhance that further on how the HSE have got involved. But we've actually gone to enforcement authorities where the employer has failed to act, and we've used the evidence that we've provided using the HSE's tools. So we've gone to the enforcement authority saying we're using the HSE's tool, we're providing this evidence, the employer doesn't want to talk to us, so we believe the stress risks are remaining uncontrolled. And that's the key issue. You know, I don't believe in, there's a current narrative that's going around saying, we need to make people more resilient to stress. But I think for us to do that, we've got to understand the causes of stress, and that goes down to the employers fully understanding what the causes of stress are and acting. And when the enforcement authorities get involved, then the employees tend to act.
Yeah, absolutely. And we will be hearing more from Dave and Shirley shortly about exactly that enforcement authority. Just one more question for you, Jamie, for now, is the information that you've gathered when you've been doing stress risk assessments, what then do you do with it? Like, what practical tips can you give the audience on what they use that they can use with the information that they gather?
Yeah, I think the first point I want to make really is if we're doing individualized stress risk assessments, and the HSE's talking toolkit is another example of that, make sure you keep contact with the people you're supporting, develop your skills, learning the difference between what is a listening ear and empathic listening, because it's really key. And also then, make regular contact with the people you're supporting and give them updates as well. Because if they take time to complete these surveys, or they take time to come to you and, and the undertake a stress risk assessment, an individualized stress risk assessment with you, it's important you tell them how it's developing and how their stress action plan looks. Because any stress action plan that's developed, the individuals should be involved in that, because basically their responses are designing the stress action plan. So again, I could share examples of that with what stress action plans look like, because again, it sounds complicated. What is a stress action plan? It's not that complicated. It's listening to the information, it's harvesting the information, and responding to the key areas where risk is presenting.
That's great, Jamie. We've just shared an action plan template in the chat as well, so that the audience can see an example of what might be included in that. Thank you for giving us that information. You're going to stay with us to see any questions we get later, but we're going to hear next from Shirley, who, as I said, is a UCU rep, and along with Dave, they have been conducting work around stress as reps in their workplace, but they are quite unusual in that they did get the HSE involved, and they've got lots of great tips and information to tell us about that. So Shirley, I think you've got a bit of a history to tell us about how this incident came about and how it started.
Hi, everyone. Thank you so much for inviting us. And first, I just really want to thank TUC union officials at UCU, especially Alex Lancaster, who was really, really crucial in helping us put together our materials for the HSE complaint. When we first put in the complaint, it was in April 2024, the 50-year anniversary of the 1974 Health and Safety at Work Act, and very fond memories of attending the TUC Safety Reps Connect event there. I also just want to kind of emphasize the importance of working with other workplace unions on on safety campaigning and safety negotiations with management. Certainly, without the wisdom and experience of our Unison colleagues at University of Birmingham, especially Mike Moore, this certainly wouldn't have been able to happen. As the audience already knows, I'm a member of UCU, University and College Union, and I think historically the members that Unison represent have been kind of more personally and directly impacted by the physical safety aspects of safety policies and safety law. And I think it probably wasn't until the COVID-19 epidemic that at least our branch of UCU kind of started to think more deeply about how safety law also impacts academic members. So I wanted to say that. And I also wanted to kind of, also mention our, we have a very strong casework team at our branch. In particular, David Bailey, who's held different officer roles in our branch, and it's kind of through his, really strong advocacy of our members and the kind of work-related ill health that our members have experienced that he's kind of helped, defend for. That also kind of informed the complaint that we put together. So just wanted to kind of say that all of these things, all of these kind of that convergence helped create the energy and the momentum for putting together this this complaint. So I just want to kind of go through our complaint. There were five parts to the complaint, and the first part of our complaint to the HSC was recognizing that there was that our employer failed to conduct an organizational risk assessment. And we pointed out that the university had claimed that a 3-question staff survey satisfied their risk assessment obligations. And we pointed out how this was legally inadequate. We also demonstrated a timeline in which UCU reps had raised this as inadequate, beginning in March 2022. We provided documentation of getting our regional official involved to escalate concerns about the lack of consultation with our branch for workload consultation. We also made sure that we documented in our kind of safety committee meetings, so we had records from the minutes that were kept in our meetings, that the staff survey was being used by our employer as a substitute for an organizational risk assessment, and that's obviously not adequate. And we also provided evidence that the university was claiming that risk assessments would be completed at local level, department level, and we documented our requests to particular local departments to ask to see these risk assessments that our employer was claiming to have taken place, and we got nothing in reply. So kind of the strategic significance of that first part of our complaint was we got the university to state their position in the official minutes that it was a staff survey, was a substitute for the organizational risk assessment, and we presented that to the HSC. So the second part of our complaint was that we showed that the university knew that there was work-related stress going on, that they had the foreseeability, they had the knowledge that there was work-related stress endemic throughout the institution. And here we use the university's own sickness absence data to demonstrate that, there were over 17,000 absence days that were directly attributed to stress. The university's own data also showed that stress was in the top 5 causes of absence, and stress was the number one single cause of sickness absence overall. And 17,525 sickness, work-related stress, sickness absence days, that roughly is the equivalent of 70 full-time equivalent years lost at work, right? So we used the university survey and the university data. We also conducted our own survey in January 2024. So this was a few months before we submitted the complaint. And our own survey showed that 90.2%, over 90% of our members who responded experienced more work than they had the time available to complete it, which confirmed and amplified the university's findings. And we also used some qualitative evidence from that survey. We got comments from our members about this. So that was the second part of a complaint, was that we showed that the university knew that there was work-related stress. The third part of a complaint was we demonstrated that the safety arrangements at our university were inadequate. We wrote to the individual colleges. Different universities might be organized by faculty instead of college. Our safety reps wrote to the different college heads to ask for copies of the stress risk assessments. None of the heads of college could provide it. Our emails were ignored. And we also looked at our stress management policy, the university's own stress management policy, and we demonstrated that the university was not following its own stress management policy. So we demonstrated that, we pointed out in our complaint letter that, the policy was being ignored, which is, of course, a breach of management regulations. Perhaps the assessments might exist, but they certainly weren't being shown to us. So we could only conclude that the assessments were not being acted upon, which is also in breach of health and safety law, or that the assessments exist, but that they're not being shared with the safety reps, which is also in breach of safety law. So all of these scenarios demonstrate regulatory violations. And then kind of the last two parts of our complaint have to do with the fact that safety reps were not being given facilities time to do safety work. And so that's kind of just the substance of the complaint itself, which was submitted in April 2024. And then when it was a few months later, at the end of the year, at the end of the calendar year, so December 2024, the HSC wrote to the Vice Chancellor informing our employer of their intention to inspect that January. So within a month, we started our own workload survey, quite a comprehensive workload survey, and we launched that at the end of January 2025. And it was, a 10-part survey, kind of, and the questionnaire was based on the HSC management standards, really based on the HSC stress indicator tool that Jamie McGovern has already shared. In June 2025, when the HSC visited our employer for the first time, we submitted 3 bits of evidence to the HSC. My colleague Dave Watton's going to talk about one of the pieces of evidence, which is the report based on the workplace inspections that he conducted. But the other 2 bits of evidence was, one, a quantitative analysis of our workload survey. This was completed by one of our committee members whose academic research is in quantitative analysis. It was an over 300-page report, and that was accompanied by a kind of an executive summary that was more digestible, of a more digestible report of 10 pages. And the third bit of evidence that we submitted to the HSC in June 2025 was a qualitative analysis of the workload survey. And the qualitative analysis was, based on the free text comments that we got from our members. And this was a 10-page report, done by one of our committee members who has expertise in trade union research and also expertise in survey analysis. And then it was in September of last year that the HSC visited us. And kind of here, Dave is going to speak more about the focus groups that we had. But I just want to say that I attended a few of the focus groups. So what was really clear was just, I think that the stories, the kind of the personal stories that our members had to share about their experiences with ill health, out of that is a result of work-related stress where, I mean, I think that those testimonies made a really, really big impact on the HSC inspectors. Anyway, I'll thank you. Thanks so much. And if there are any questions, I'm happy to answer them. But I'll turn it over to Dave now. Thanks.
Yeah. Thanks, Shirley. That was really helpful. I think, especially in how you put the complaint together, the different stages of evidence that you needed to present. So, Dave, you're going to talk to us about what actually happened when the HSE inspectors came to your workplace. And I think this is something that lots of the audience would be really interested in, because it doesn't happen so often, and you've experienced one. So do please tell us, what's it like to have HSE inspectors in?
Yeah, good afternoon, everybody, and thanks for inviting us along today. It reminds me, I was at the Manchester Hazards conference in September, and I went to a number of workshops where people kept telling me that, or kept saying, and understandably, that how rare it is to have a HSE inspection, in your workplace. So I was very pleased that we'd managed to get one so soon into my sort of tenure as health and safety officer at Birmingham. There was quite a long run-in to this process, because we first heard that we were going to have an inspection just before Christmas 2024. So that's over a year ago, but it took until September for the inspection to actually happen. And I think one of the reasons for that was because the HSE contacted the university and asked for a large number of documents, so evidence of things like, a stress management policy, risk assessments, monitoring procedures, all of the sorts of things that the university was in the end found in contravention of. It's important to say that the notice of contravention found the university to be in material breach of the law in the end. So that was the outcome, the reprimand, if you like. So there was a long sort of lead in. And so initially the inspectorate were going to come in June. Because the university wasn't able to provide all the documents, there was a lengthy delay over the summer holidays. So in fact, they only came in September. We were invited in June to a kind of, so the HSE visited the campus for a day of kind of familiarization, to sort of meet with management, to look through documents, to discuss, to ask questions. And we were invited. So campus reps were invited to a short meeting. It was only about half an hour, so we were able to meet them. And that was quite useful, just to sort of put some faces to names and, establish a bit of a relationship. And then it was interesting because, most of the interaction, I think, between the HSE and the university was with the university management. So it felt a little bit frustrating at times that often we didn't quite know what was happening. There were lengthy periods of silence, but I think it was sort of perhaps about a month before the actual inspection in September, the HSE lead inspector got in touch with us and kind of laid out the parameters of how the inspection was going to work. So essentially our involvement really was to organize a series of, I think it was about 6 or 7 in the end, union-led focus groups. So we could invite our members to the focus groups, which were attended by 3 inspectors, each one. And at the same time, the university was invited to put together a sort of parallel employer-led or employer-chosen groups. And so these groups would be Our groups were quite small. They were up to about 8 people. I think the university group focus groups were bigger. There might have been about 20 staff. I didn't go to one, but I think they were slightly bigger. But it was interesting attending those focus groups. I went to about half of them, so I could kind of, hear what members were saying, bearing in mind there were also Unison members, which is our other main campus union as well. And something else that was actually great to have on the first day, we had, as Shirley mentioned before, our national UCU health and safety kind of chief negotiator, Alex Lancaster, came along to sort of sit in on the groups, and also Janet Newsham from Greater Manchester Hazards, very experienced campaigner. So they were kind of sitting on some of the union groups, and they were able to perhaps ask some kind of or make some pertinent comments or ask questions. But it quickly became apparent in the groups. I mean, we didn't tell members what to say. We didn't have a kind of what would you call it, a sort of orientation meeting. They just came along on the day. And it quickly became apparent that essentially, the inspectors were asking questions like, do you have a stress management policy? Have you seen it? Do you know how it works? And everybody was looking around the room, sort of, mystified. No, don't know anything about this. Haven't been involved with it. Don't know how it works. And likewise, they asked us about stress risk assessment. So, have you seen a stress risk assessment? Have you been involved in putting one together? No, sort of nobody was able to answer in the affirmative. So, it very quickly became apparent that, there was a major problem. And I think that was clear from the response of the inspectors. So they then sort of asked us, ask people questions about their sort of daily sort of lived experience. And the whole process was, it was a good opportunity to air, from a range of staff to air their experiences. So yeah, maybe I'll stop there. For now.
That was great, Dave. Thank you. I imagine that many people on the webinar have never experienced what an inspection is like. So I think that was really insightful to hear. Before I hand back to Shelley, just to talk about some of the tools that we've got, I just wanted to flag a message that you might not all have seen. Many of you have asked Shirley if she can share any of the case that she put to the HSE, and she said she is currently putting together a portfolio of documents, including the original complaint. So that, and she's happy to share when it's ready. So Shirley, we'll stay in touch, and we'll, when you're ready, you can send it to Shelley and I, and we'll take that forward. So Shelley, before we look at questions, did you want to talk about the tools that we've got from the TUC that can help reps do these stress risk assessments?
Yeah, so to help you organise your own campaigns, put pressure on your employer to not only conduct a stress risk assessment, but to actually follow through on preventative action, we've created some new tools. We've got an overall guide on getting your employer to carry out a stress risk assessment, why it matters, what you can do to convince them to act. That's all covered in there. And then we've also got a guide on using your right to inspect the workplace to look at stress. So using your right as a safety rep to carry out a workplace inspection, using that as an evidence gathering exercise. That guide also includes a checklist. Obviously, it's just a starting point. Different workplaces will have different risks and stress triggers, but you can use that and you can adapt it, change it, add to it, whatever. So the next time you do an inspection, walk around, consider making it specific to stress. We've also got a template letter you can, again, adapt and send to your employer requesting a stress risk assessment. So it just starts that conversation with the employer saying, look, we haven't got a stress risk assessment. Can we meet to talk about why we need one? You can maybe include any evidence you've gathered from an inspection or a survey in that, or you could just get that conversation started. So it's a template letter that, again, you can change to suit your workplace or employer. We've got an example stress survey you can adapt and use with your members to help you get a clearer picture. gather any relevant data you can use as evidence to show your employer that action is needed. We've talked a lot about the HSE stress indicator tool, which is again a template stress survey. If you just want to do your own one, you can use our template. Also, the HSE one does charge if you're an organisation, I think, with over 50 people in it. So again, this is just a way of doing it for free. You can use any kind of survey platform to host those questions. You can download all of these from our website. My colleague Yusuf will be posting those in the chat. But yeah, check the chat for links, but we'll also share them with you via email. Feel free to make use of any or all of them. I do want to draw your attention to some of the HSE's guidance and tools on this as well. So the HSE has the stress management survey. This is something all employers should be implementing. It gives a clear framework for managing stress risks. The TUC and HSE have joint guidance on this. And then again, the stress indicator tool. So essentially a tool to allow you or your employer to create a survey. The HSE also has 2 upcoming webinars. So one on January the 29th and one on March the 5th that are all about managing stress. I don't know exactly what will be included in those webinars, but I think it will be useful for us to hear from the regulator and ask them questions. Equally, I think it'll be useful for them to hear from a bunch of safety reps or union reps, not just from employers. So do consider signing up for those as well. And again, we'll share those links. Thanks, everybody.
Thanks, Shelley. As we said, there was a lot of links that Shelley talks about there. We'll make sure they're all sent round to you because they're going to disappear quite quickly in the chat now. Shelley, we've actually had a lot of questions from the audience that I don't think we're going to be able to get through all of them, but I'm going to highlight a few. There's one that you indicated that you wanted to answer. We've talked a lot about the stress indicator tool and the question, getting information from members. But what should a rep do once they've got the information in from their members? They've said, what do you do after filling in the questionnaire?
You tell the employer what you found. I think you say, look, X number of or X% of our members are stressed. These are the things that are making them stressed. We want you to do something about it. It's not for you to conduct that stress risk assessment, it's for your employer, but you can give them the hard evidence and show them what is causing people to become stressed, how many of them are stressed, which particular departments there's more of a problem or less of a problem, things like that. That's the kind of really useful data that you can gather by doing an inspection or doing a survey or both, and put the ball in their court, so to speak.
Thanks, Shelley. Not surprisingly, we've had quite a few questions about enforcement authorities. So Dave and Shirley, you talked specifically about the HSE. We know that that's not always the enforcement authority. Dave, Shirley, and also Jamie, if you've got experience of this, can you talk a little bit more about using them? Like, at what point would they be approached in the process, and what are the benefits of doing it this way? Feel free to wave at me if you want to go first answering that. Go for it, Jamie.
Yeah, so I mean, in our experience, we've always found they're a really useful arm, really, when you want to make sure the employers are there to listen. It's difficult because the employers will often choose to ignore the information being presented, but they can't choose to ignore it when stress evidence is clear. We've used the enforcement authority a few times, okay, and from my understanding and my experience, the enforcement authority wants to know as much information as it can before it acts. Got to remember as well, the HSE doesn't always, as you've mentioned there, and doesn't always have the jurisdiction. So it's getting to the right enforcement authority and making them aware of the issue. But if you use like the standards and you can quantify the risk levels, then we found out the enforcement authorities are more willing to try and engage with the employer. We're actually in the process of 2 current contacts with enforcement authorities based on stress evidence that we've found. So they are now taking the natural path. But I don't think anyone should ever be afraid of contacting the enforcement authority. Obviously it's a safety rep's right. If they're identifying that there are emerging risks, and stress is so significant as an emerging risk. If people are finding out these emerging risks are there, then don't hesitate. If you're not getting a satisfactory response off the employer, then potentially think about the enforcing authority as the next move.
Thanks, Jamie. And I think that tallies with what you said, Shirley, earlier, that you were finding that any attempts to discuss this with the employer didn't really go anywhere. So you had no choice, right?
Absolutely. And Dave, I think you can also attest to just having our meetings that have been set up with the employer canceled, not having a satisfactory response to our queries, in our in the kind of the official channels that we have for negotiations. And keep in mind, we're all volunteers. We do have facilities time to do our work, but we are volunteers, and a lot of us kind of go beyond our allocated facilities to represent our members. And so kind of the work that went into escalating to the HSC, it was considerable. And we only did that because we were getting kind of no love from from management. So it was kind of it was after kind of several years of feeling quite frustrated and 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 our concerns not being taken seriously. Dave, I don't know if you want to kind of come in on this
I
as well.
suppose just to add, it's not really quite answering your question, but just to add that my feeling is that even with the notice of contravention, which has kind of picked the university up on lack of risk assessments, not using their stress management policy as it's laid out, not involving, it explicitly states that the university is not consulting with its staff or its employer reps, people like ourselves. And even in the light of that, that notice of contravention, the actual culture or the attitude of the management of the university has not changed. They haven't openly acknowledged the reprimand. There hasn't been a kind of any messaging to staff. So we've obviously been telling our members, but there hasn't been a message from the Vice Chancellor about this. There's still a policy of kind of, it's the first rule of Fight Club, don't talk about Fight Club. There's this kind of incessant this obsession with only positive news and things like reputation management. So, for me, my kind of, rather sort of maybe high-minded ambition is to kind of change the culture at the university to create a culture of health and safety. And we're still so far away from that. But we've had an interesting discussion the last few days with members about where that change comes from. Does it come from the top? Does it come from management? Or does it come from the bottom? Does it come from the grassroots and activism and reps and union activity? And my feeling is this probably has to come from both. But we're so far away, and we have to. And I think the lesson from Birmingham really, and I think Shirley has kind of really captured that in her initial account, was you just got to keep chipping away. You're not just going to get the health and safety executive to come and inspect your workplace in 5 minutes. You've got to have your ducks in a row. You've got to go through all the official channels. You've got to have the meetings, ask for the stress risk assessments, keep chipping away, take minutes, kind of use, what I think what's been critical for us is our national rep at UCU has been our safety rep at UCU has been instrumental, helped us with the complaint. Use the people, use the resources you've got, and keep chipping away. It's not going to happen overnight, but with persistence. And I think the persistence and tenacity of my colleagues at Birmingham, that's what's made this happen, and I'm proud of them.
There's some great advice there. Thank you, Dave. And yeah, you're right. It's not a quick process. There's a lot of kind of groundwork to do, I think, before you get to that. Unfortunately, it shouldn't be that you have to do so much. But I think the experiences of all of you have shown that. Okay, we've had another question here about, and I'll put it to all three of you. What are your thoughts on the view that workplace stress surveys should only be done in partnership with the employer? particularly if there's a partnership agreement in place. Have you ever done one that's joint, or is it always union led? Jamie, do you want to start us on that one?
It can be done with the employer if there's a full buy-in from the employer to react to the findings. I mean, like I've just mentioned there with our escalations, when we've raised escalations, the escalations have come because the employer has failed to put in a robust stress action plan or consider our determination or our efforts for a stress action plan, or even acknowledge that a stress action plan is needed. So if you're working with an employer like that, then it's more difficult to do joint stress surveys. But we've done most of our stress surveys on our own as a trade union. And I think I've found from my experience, very often people will tell you the honest truth when it's trade union to trade union members. I also want to reference the fact that sometimes as trade unions, we also have to take the management outside of these processes, because if you look at individualized stress risk assessments, for example, if a manager is a cause for stress and then it has the responsibility of doing a stress risk assessment, stress risk assessment is going to go nowhere because the individual is not going to feel comfortable providing answers to the questions that are coming from a manager who is potentially causing stress. So from our experience, we've tended to be more independent with this, and make sure our stress surveys are done by, us as a trade union. If the employers fully buy in to the stress management needs, then yeah, why wouldn't we do it with the employer?
That's some great advice there, Jamie. Dave and Shirley, I'm assuming in your context there was never really going to be a joint stress survey because of maybe I'm going to be proved wrong.
Yeah, we've had some interesting discussions with our employer about surveys, because our employer shared with us that they had a very kind of low response rate to some of the surveys that they've conducted, particularly among academic staff. So they always they shared with us that they get a higher response rate from academic related and professional services staff. But it's interesting, in our own survey, we got a very, very high response rate from academic staff and a lower response rate from academic related and professional services staff. And I think in the university survey, you get a unique link to the survey. And it was disclosed to us that while the survey results are anonymous, the respondent's department is revealed to the employer, right? So whatever kind of answers they give, it'll be attached to the department. And some of the departments are quite small. So I think there was, when you're responding to the university survey, you can be sure that your line manager will see your survey results, and if they have kind of sight of some of the demographic data or identification information that is attached to your answers, they could figure out, like, oh, so you're the one who said that you scored our department low on well-being. And the fact of the matter is, like, and yesterday we've had a kind of a series of meetings with our members over the last few days, and actually yesterday one of our reps kind of told us that their kind of local department was being reprimanded by kind of higher management levels because the respondents in their local department had kind of given a low rating to a series of questions in a survey that was conducted to them. So yeah, that's kind of sorry, that's not a direct answer to your question. Dave, I don't know if you've got more to say on this.
Yeah, I mean, I think the what people have said is valid, and I mean, what the university puts out a what's called a staff survey I think it's every 2 years, and it's a very broad sort of, and the kind of answers I think they get depend on the questions they asked. It's designed by a sort of an external sort of consultant company, but there's I think there is a question about workload or some, but it's very brief. And when we've done surveys and when we do inspections, it allows us to go into a lot more detail. And as Jamie's mentioned, we kind of try and cover all of the stress management standards, the 6 main management standards. So I think we're coming from a very different place, and we're getting very different information back. And it's a kind of tactic that the management uses, is to question our methodology all of the time. So there's, I suppose we're never going to see eye to eye on this. But I think personally, I think it's hard to work together. I think, as Jamie says, maybe in certain workplaces that might be possible. I think it's difficult for us at the university.
Thanks, everyone, for your contributions there. I'll be clear with the audience now. We're not going to have time to answer every question because there has been a lot, but we aren't going to ignore them. We are going to, we'll take the questions into consideration when we're putting more information out about this subject in the future. You can also send any questions into us at the TUC. We have a dedicated health and safety email address, which we will share with you all. We'll put it in the chat now, and we'll make sure it's included in the follow-up email. I'll see if we can fit in one, maybe two more questions. So Dave and Shirley, in your specific situation, was there any discussion with you on why the HSE issued a letter rather than a formal improvement notice? What fed into that outcome?
I'm not quite sure of the difference between those two categories.
Okay. Right, not to worry, we'll come back to that.
My understanding, so we were issued with a notice, what's called a notice of contravention.
Okay.
Which is, I think, probably about the sort of third level. There's something like 5 levels. I mean, actually, Jamie might be able to answer this better than me, but there's sort of 5 levels of kind of response, outcome. I mean, ultimately, the highest one would be a kind of, legal action. But then there's something called, I think, a prohibition notice below that, which is so a legal action would be, impending risk of death or serious harm. I think a prohibition notice is more serious than what we got. That's a sort of very, very sort of high level of intervention. The notice of contravention we got is essentially means that the organisation has to repay the cost of the inspection. So they reclaim, entitles the HSE to reclaim fees. And at that point, the organisation is required to put together an action plan within a specific time frame. So, sorry, I'm not sure if that really answered the question, but that's sort of what we received.
No, that's great, Dave. Thank you. Jamie, did you want to add anything to that? If you've maybe got a bit more experience.
I think Dave really answered it well, and the fact that you actually got an inspection from the HSE, because there'll be many reps on the chat, who would desperately want an HSE inspection, HSE visits at a workplace. So, I think you answered that quite well there, Dave. And I think there'll be a lot of envious reps on the call there. The fact that your university actually got a visit from the HSE.
Yeah, I suspect too, because they don't happen that often. So it's really interesting, as I said before, to hear about the detail of these. What I'm going to finish with is probably quite a general question. How can reps encourage members to come to them with problems early in the process? Let's say, if it's a health and safety problem, but this could be applied to any workplace situation. What are your tips to get them to come to you early, perhaps before it escalates, so that you can tackle it before it gets worse? Shirley, how about you first, please?
Sorry, can you just say the question again?
Sorry, what tips have you got for reps to say to members to encourage them to come with their problems early in the process to avoid a situation escalating? This is about stress. How can you encourage members to talk to you?
Well, I would say that we have a strong casework team. I would say that our department reps network and kind of like our grassroots union density is a bit weaker than the kind of the activism that's led by the committee kind of on that end. So we're working on, so our members talk to us through casework, basically. Our casework email address is highly active. Dave has, since Dave has become our elected safety officer, he's conducted an array of workplace inspections, and he's been able to, talk to members interview members during the course of those inspections. Dave, I think the key is to listen, to kind of listen to what our members are saying, to try to kind of to listen, to observe, to collectivize the themes and what we're hearing from our members. Talk to one another, I'm in constant dialogue with my fellow committee members about the themes that we hear back, try to collectivize the issues in our different conversations with management, in our kind of different meeting spaces, whether it's regarding occupational health, equalities, or safety. Dave, do you have anything else that you'd like to add to that?
Yeah, just briefly, I think it is about just as committee members putting ourselves out there as well, being approachable, having regular members meetings where we speak. We kind of try to invite, we've had one today. We've got another one next week. We had one yesterday. So, getting out there as much as possible. But, one thing to mention is that this year, I think, one of my goals as a safety rep is just to really trying to build more of a network of safety reps across campus, because as with one or two people doing all the work, it's very hard to make progress. So one idea is to because we have a network of departmental reps. We have this great big huge university, lots of different departments, so it's a big beast. And to try and encourage somebody who is already a departmental rep to be a safety rep as well. So that way they are the kind of eyes and ears, they've got an ear to the ground, they've got a bit more awareness of health and safety issues. So that's a way, as you say, of kind of like trying to, nip things in the bud before they escalate.
Thanks, Dave. And Jamie, one final word before we close.
Yeah, I think maybe to people is to understand the risks, step forward whenever you can. And some trade union reps will actually be more competent in undertaking these risk assessments, and some managers are understanding the risks, certainly. And if unions can develop the listening skills, one of the key messages we teach on our mental health first aid training is the acronym AGE: acceptance, genuineness, and empathy. If you can display those, then all of a sudden you're in a better position to support members when they're stepping forward to be supported with stress issues.
That's a fantastic note to finish on. Thank you so much for that, Jamie. And what a way to start the webinars of 2026. It has been the most fantastic hour. We've all learned so much. So thank you to Shirley, to Dave, to Jamie, and to Shelley. And I look forward to seeing so many of you again on a future webinar. Bye-bye for now, and see you again soon.